Welcome to the Knight and Rose Show, where we discuss practical ways of living out an authentic Christian worldview. I'm Wintery Knight.
And I'm Desert Rose.
Welcome, Rose. In today's episode, we'll be discussing healthcare policy and how it affects Christians, and then we'll evaluate the American healthcare system and see how it could be improved. So before we get to the details, let's first ask why Christians should care about healthcare policy.
Okay, well, I can think of one reason off the top of my head, probably a dozen. So first of all, I mean, stewardship of resources is a big issue, because if individual Christians and families have to spend a big chunk of their budget on healthcare, that leaves less money for giving to charities, for apologetics training, for mentoring, for buying books, for others, and all the things that we love to generously give our money to. So
yeah, definitely.
You can't do that if the government's taking all our money for healthcare needlessly.
Yeah, a dollar can only be spent one way. Either it's going to a William Lane Craig book, or it's going to, pay for expensive healthcare. I have one. If healthcare is really expensive and we run up debts in order to cover the expenses through government programs, then we're going to be burdening our children and grandchildren with future taxes. And this is becoming an issue as healthcare spending becomes a bigger part of our budget.
Yes, definitely. And something you and I have talked about as well is the religious liberty issue. Government-run systems increasingly force Christian taxpayers and Christian companies to fund procedures like abortion. We've talked about the Hobby Lobby situation and how they had to fund abortions despite being a company started by Christians and who object to the ending of babies in the womb.
Yeah, related to that, one of the ones that bothers me a lot is when you have a Christian doctor or a nurse working in one of these healthcare providers and the government forces them to participate in procedures that are against their consciences. This actually happens quite a bit, especially in big government-run systems. But even in the U.S., there's a case of Valerie Klusterman, who was a Christian physician's assistant who got fired just for declining to support gender transition procedures and use correct pronouns. There's a case in the UK right now with a nurse who refused to use the pronouns of a transgender person who, was really rude to her and she got in trouble. So it happens a lot.
Yeah. And when you say Valerie Klusterman, refused to use proper pronouns, or correct pronouns, actually, what I know you actually mean is that she refused to use improper pronouns.
Yes.
that please.
Thank you for correcting
bosses.
me.
But yes, another problem is that countries with big government-run healthcare systems also tend to have much lower rates of religious activity and charitable giving. We talked about that in our 3 episodes, at least one of our 3 episodes on socialism. And so not only do people in countries with government-run healthcare, not only do they have less money to advocate for their own values, to homeschool their children, to give generously to people in their community who are in need, but the experience of dependency also causes them to think that these things are not their responsibility. If someone's in need, well, just ask the government. So that's a problem. Yeah. Which kind of reminds me of this whole kind of backwards compassion, I guess, toxic compassion kind of idea that has been written about more and more lately, which is a good thing.
Yeah. I mean, Christians need to be jealous about their influence. If somebody is taking your money away and they get the credit for helping other people, not only do they get the credit, but their worldview is attached to the help. Whereas if you keep your own money and you help someone else, you really help them, because not only are you making sure that they are improving, but you also attach your values to the influence that you're giving them.
So we give in the name of Christ with a worldview attached to it. Yeah, the government gives without accountability and with a secular worldview attached to it, and a message that you can live however you want, and they'll just they'll cover it for you. But yeah, countries with big government-run healthcare systems often use healthcare to buy votes as well from their favored constituencies, while denying care to others, like the elderly, for example. So if young people's votes are needed, then they know that they want to win over these young people for the next 60 years to come, then they'll certainly be in favor, as we've seen in some countries, of offering breast enhancements, but not treating the elderly for cancer. Things like
we
that.
are going to talk about that.
Yes, we are.
And I have one more for this list, and this is a bit more subtle. So I would say, having done apologetics in the workplace with really smart non-Christians from, Muslims and Hindus and that, then I would say that Christians who talk at a high level about practical topics like healthcare policy are more likely to be invited to speak about spiritual topics and more likely to be taken seriously when they talk about spiritual topics. If I have an evidence-based way of arriving at my conclusions in one area, people immediately think, oh, that's the way he gains knowledge, so I can trust him when he's talking about something else.
That's a great point. I hadn't even thought of that.
Awesome. Okay, so let's get started discussing healthcare in America. So I have a funny story. So I was not born in America. I came to America from another country that had a more government-run healthcare system than here, if you can believe it. And so when I came here, I didn't even use healthcare for a long time because I had no idea how it worked. In the previous country, you just walked in and everybody was, treated the same. You had a card. That was it.
So kind of like you didn't know how to work the mailbox flag.
Yes. Okay. So I went 20 years renting because I was afraid of getting deported if I lost my job. So I eventually bought a house. How long did it take? 19 years later, I bought a house and I got a mailbox, and I did not know that you could lift the flag on the mailbox and the mailman would take the outgoing mail out. So I would always go to the post office. Okay, we don't need to bring that up, Rose.
I was the one who got to teach you about that too, which is quite the honor, because I think we were talking about what time we were going to record or something, and you're like, well, I have to run to the post office because I have mail to send out. I'm like, why don't you put it in your mailbox? And you're like, why would I do that? That's where they deliver the mail.
They should have explained that to me. Okay. So similarly with healthcare, I was like, I don't know how to use this, so I'm not going to use this. So let me just explain to our listeners. We have listeners from all over the world, and some of them talk to us even. So we're good friends with them. So I'm thinking of like Tom and so on. Victoria. And Kevin, Victoria. And so these are different countries. Okay, so let me start from the ground floor for you guys. So if you need healthcare in America, typically you go to your primary care physician, who is like your family doctor, and they will give you your regular physical and your lab tests. And if you need something else, they will refer you to a specialist. If you have some kind of an emergency where you like fall and break your leg, then you might go directly to a hospital, and then the hospital doctors will take care of you because it's like an emergency. The hospitals are really expensive. Okay. So I've never been to one. What I do instead is if I need something, we have these urgent care clinics that are just on street corners. And also there are even clinics inside of retail stores like Kroger and Walmart. And you can go there and you can get cheap stuff done. That's like regular kind of things that you would run into.
Like for a cold or something, right?
Exactly. Yeah. And so that's pretty cheap, and you can just go there as long as they're open. Sometimes they have 24-hour ones. So, and then the last thing is a lot of insurance plans are offering telehealth now. So you have, rather than making you go to the doctor and running up a huge bill, it may be $120 or something. You can just call a doctor and they'll say, what do you have? And you tell them the symptoms and they go, that sounds like a cold. I'm going to prescribe you, something for that. Yes. So we have different ways of getting the healthcare.
Yes. And then after you get treatment, of course, somebody has to pay for it. And so there are actually several like healthcare systems, I think it's fair to say, in the U.S. So there's employer-sponsored insurance, health insurance, which pretty much anybody with a job, and I think it's fair to say everybody with a full-time job, right, has employer-sponsored insurance. And the employer and the employee split the premium. And then there's Medicare, which is for 65 and older people. It's a federal program, and there are payroll taxes and premiums involved in paying for that. Then there is...
Wait. So you're telling me that old people don't just die from denial of care? That's what my old country used to say about American healthcare. So old people, they don't give them any treatment? So I have to say this because there are myths going around in the country where I'm from. So I have to mock them.
No, we don't just let old people die because they don't have enough money. In fact,
okay, but poor people, you let poor people die in the streets, right?
Poor people, no.
That's what I was told.
So no. So for poor people, we have a program called Medicaid. There's a whole other program. And if you're old and you're poor, there may be some overlap here and you might get some benefits from both. But Medicaid is for poor people. Medicare is for old people. And so this is like a joint federal and state funded program.
Got it.
So
probably paid for with like payroll taxes or something like that. I'm sure I've seen that on my pay stub.
Yeah. And then there's the Veterans Affairs and military-related health insurance, which I was on when I was a military wife very, very early on in my marriage. And it was quite awful, but that was my experience and the experience of lots of people who have messaged me about it since. But this basically the government pays for health insurance for military families.
Got it.
And it's very restricted who you can go to, and there's no competition. And so, you go to who they say to go to, and they're not trying to keep you as their customers because that's who you are allowed to go to.
Right.
And then, so for people who don't have any of those, they don't have a job, they're not old, they're not poor, and they're not in the military, there is private individual healthcare plans through the Affordable Care Act, which is colloquially called Obamacare.
Yes.
And about 11%, I think, of Americans or so are on that. And then there is probably about 8% of the population is uninsured, but that is by choice, as we've just said. I mean, if you're, whether you're poor or old or employed or any of these numerous categories, their health insurance is available.
Yeah.
Even the Obamacare plans that you buy privately, there are heavy, heavy subsidies for people with low incomes. So
right. So only 8% of the people are uninsured. Most of them are uninsured by choice. I'm thinking of like a 20-year-old man who's like living at home and going to school next door or something, it's not that risky. And you don't want to pay hundreds of dollars for healthcare if you just don't think anything's going to happen.
Exactly. And I've had some friends in their 50s and 50s, early 60s in the past who said, I'm not going to pay for health insurance when I've never used it and my doctor says I'm completely healthy. Why am I going to pay this exorbitant amount of money for health care when I can just pay nothing and I'm wealthy and whatever, I'll just pay for whatever comes my way and maybe have like catastrophic insurance or something like that.
Right.
So the American healthcare system is expensive compared to other countries. People bring that up a lot, and that is true. So we want to talk about some of the reasons for that, though.
Okay.
One of the reasons for that is that, as I've just talked about, either the insurance companies or the employers or the government pays most of the bills. So patients don't see the prices of the services that they're receiving. So they don't get to compare to find the best deal. They don't get to make an informed decision to say, oh, you know what, that's thousands and thousands of dollars for something that I don't really need, that is just kind of a luxury. Yeah, I'll just pass. It's no big deal. It may be a bit too strong to say it's just not an option, right? But it's a ton of work. It is very difficult to compare prices and try to find the best deal. In many cases, it's just not even possible.
Yeah. Yeah. And another couple of problems are related to lawsuits. So America is very litigious and doctors are afraid of getting sued if they don't treat something and it turns into something big. So this kind of fear of trial lawyers causes doctors to do what's called defensive medicine, which is ordering extra tests and scans to avoid lawsuits, even though it's very unlikely that those things are needed.
Yeah, and they tend to be like these extremely expensive tests that are just not necessary, but they're doing it to cover their own butts.
Yeah.
So, yeah.
In addition to that, so suppose that somebody does sue a doctor who, is accused of something. The payouts can be really huge on those. Right. And because the doctors don't actually pay for this out of their own money, they have insurance themselves called malpractice insurance. Well, their malpractice insurance premiums will go through the roof the more doctors get sued for these things. So some states actually cap the amount that can be paid so that to keep the premiums down so that the healthcare is cheaper. But those are reasons why healthcare is expensive.
Mm-hmm. Also, big hospitals and hospital systems have near monopolies, which blocks competition and new entrants to the healthcare providers. They make it very, very difficult for new people to enter and for new hospitals, new clinics and such to develop. And so less competition means that there are higher prices and lower quality. There's also high administrative costs. So there are all these extra regulations, and it costs a lot of money to comply with regulations. You have to hire people to fill out the paperwork and train them and make sure they know how to fill it out properly, and have people available to respond to questions and interactions and such regarding the regulations and do the audits and all of that. So that costs a lot of money. There's also the fraud and waste in government programs. I don't think any of our listeners are going to be shocked to hear that there's fraud and waste in government programs.
We're hearing about how bad the government is with that in Minnesota right now, and California.
Exactly. And California and Maine and Nebraska. Yeah.
The people in the government don't treat your money as well as they would treat their money if it was theirs.
Exactly. And they don't treat my money as wisely as I treat my money.
Exactly.
They don't spend my money as wisely as I spend my money.
We're giving hints about how we may fix the healthcare problem here going forward. We have so many ideas to share with you.
Yep. And then this is a big one that I think people need to know about: emergency room use. When people come to the United States illegally, or when they come here even legally and they don't really know how to work the system, use the system, or they choose to be uninsured, when they get any little thing, they tend to go to the emergency room. I know this because I worked in the refugee community of Clarkston, Georgia for 5 years with refugees and with some American-born indigent families and such. And so on numerous occasions, I was asked to take a child to the emergency room because of a stuffy nose. I would come on Monday to teach some kids and I'd ask them about their weekend and find out they had gone to the emergency room because their mom suspected they had a little bit of a cold. I was asked even to take a 6-year-old boy to the ER because he had bad breath. This boy didn't have bad breath in his country of origin because he didn't eat candy all day long. But in the public school systems, they were handing out candy all day. The kid didn't brush his teeth. The parents weren't in the habit of even really needing to brush teeth every day because they just mostly ate healthy food where they came from. And so this kid's eating a bunch of junk and garbage and not brushing his teeth. He has bad breath. And they're like, oh, he needs to go to the ER. This is a big problem.
Wow.
And meantime, ER is supposed to be there because it's an emergency and you're going to die if you don't get help right this minute. Yeah. And so they can't turn people away at the ER. And so those of us who pay, exactly, by law. And so our insurance premiums go up. We have to pay for the people who go there for free.
Yeah. I want everybody to get that. If you have health insurance, you are paying for the people who don't have health insurance. Right. That's why everything is so expensive. It's one of the reasons. We just gave you a big list, but that's one of the reasons why American healthcare is so expensive.
Exactly.
Because we don't turn people away at hospitals, unlike what you would hear if you were from where I'm from. Okay, so let's talk about something different. So America has several healthcare systems that are regulated by the government, and they cost a lot, and they don't work very well. So let's talk about those.
Let me guess. Medicare, would that be one of them?
Yes, Medicare is the biggest one. So this is about $1.1 trillion every year. And so let me give you a scary number to show you how doomed we are. So Medicare has different parts. There's Part A, Part B, Part C, and Part D. So for Medicare Part A, this is the part that deals with hospital care, nursing care, hospice care. And the CBO says that the Medicare Part A trust fund is going to be depleted by 2033, which is 7 years from now. And that is 3 years earlier than the previous estimate. So we will not have money to be paying for this. That is going to trigger automatic cuts in payouts to doctors. And that is not good if you are seeking care, because I would imagine that if the doctors are getting half of what it costs to treat you, that they are going to decline to treat you.
Exactly.
So big problem looming.
Doctors already do that. They decline. Some doctors
Yes.
decline to take Medicare patients. Many decline to take Medicaid patients.
Right.
Because the government only pays them a tiny fraction of what they should get paid.
Right.
So, yeah.
And you can't just solve this problem by raising taxes and spending more money, because we're out of money in a little while. So you can't just go, we'll just pay them more. We don't have the taxpayers to treat a large number of elderly people who are needing Medicare Part A care. So compassion isn't going to make the money appear. All right. Next problem. So we have a problem with improper payments. Now, I don't want to say fraud here because it's more than fraud. So it's improper payments. So this is healthcare providers billing the government badly. And this resulted in $28.83 billion of improper payments in fiscal year 2025, which is 6.55% of all payments. And I got these numbers from CMS.gov, which is the real Centers for Medicare and Medicaid Services. Right. Wow. We're totally doomed. In addition to that, so we talked about two problems. There's also the fact that people who are on Medicare are paying rising out-of-pocket costs. And this is particularly for the Medicare Part B and D deductibles, as well as coinsurance. So this is creating burdens on seniors who are on fixed incomes because their costs are increasing, but their incomes are fixed. Mm-hmm. In addition to that, Advantage plans often feature restrictive networks, which means if you need a specialist who's out of the network, you may end up getting a much higher bill or maybe even being denied care entirely. So how would we fix this? One thing to do is obviously for the improper payments, we could have audits and we could use AI to review claims. I am going to betray myself a little bit by saying I've actually worked a lot in the insurance industry, including in the medical insurance industry. And we had automated tools for reviewing claims. And if you submitted a claim and we noticed that there were certain things about the claim that were suspicious, we would refer that claim to a real human. But a lot of the claims that didn't have anything suspicious, we would just process them, without asking questions. And so that would be a really good thing to cut down on improper payments, and also perhaps give penalties to healthcare providers that had a high rate of claim errors so that they would clean up their business. That would also probably cut down on that. Mm-hmm. So that would be getting rid of the $28 billion. It's really more like $29 billion. Yeah. An additional thing would be to reduce costs. We need to reduce costs. So introducing health savings accounts, which are like tax-free accounts that people own, would put the decisions about where the money gets spent in the hands of the people.
This was something that Ben Carson was running on when he ran for president. Mm-hmm. He wanted to have health savings accounts. These are great because they lower costs, because basically the money, my health savings account is an account with money that belongs to me. And I decide how to use it. And as we've already said, that's going to lower costs because I care about my money and how it gets spent more than the government cares about my money and how it gets spent. It's easy to spend other people's money more irresponsibly than it is to spend your own money irresponsibly. But let's talk about Medicaid. So that was Medicare, but let's talk about Medicaid for low income families.
Yes. So Medicare is for the elderly and Medicaid is for the low income. So Medicaid also has problems. This is about $900 billion a year. And Medicaid spending is growing also in an unsustainable way. And for the improper payments there, we're talking about $37.39 billion in fiscal year 2025, which is 6.12% of all payments. Again, that's from CMS.gov. And they're facing problems with limited provider networks and low reimbursement rates, which lead to long wait times, difficulty finding specialists, and, like you mentioned, many doctors refusing new Medicaid patients because they aren't getting paid enough. So how would we fix that? It's similar to last time. Stop improper payments using the methods that stop bad billing requests, but also pushing the money down from the federal government to the states. Because remember, this one's jointly federal and states. Well, the more you push down to the states, the more the states have a reason to try to save money. And they will be more careful about how they do it because they have to pay for the excess. So they'll be careful.
Like right now, since so much money goes into a federal pool and the federal government keeps bailing out states like California and New York, they just keep spending it. And then, states like Tennessee is a conservative state, for example.
Awesome conservative state.
Yeah, they don't spend as much money, but then they end up having, they put their money in the federal pool and they end up having to bail out California, which, of course, doesn't lead to any improved decisions out of California.
We just did that for their stupid wildfires. They're just so bad at governing. Sorry, California listeners. Sorry, Nathan.
I think Nathan already knows.
Yeah. Okay.
Okay. So what about Veterans Affairs? This is for military and their family.
Yes. One other quick thing I would say for the Medicaid, we could have per capita caps on states. So basically, if individuals are using excessively, we could cap it and, just say, I'm sorry, but you can't keep using this for gender transitions back and forth and back and forth. All right. And then
but
also,
what if you're gender fluid? Then you have to go back and forth.
Well, you have to pay for it yourself. You can get it. You just don't make me pay for it.
But I don't feel like it. My feelings don't want to.
Too bad. Okay. Well, we're running out of money. That's why that's funny, but we're running out of money for this stuff. We got to grow up. We got to grow up. And you could even make it so that people who are using this have to either work or do work-related training in order to keep their coverage. All right. So let's go to the military stuff. Military stuff is actually getting better, I feel. They are facing long wait times, average of 35 days. And I know Canadians and UK people will go, that's not long. Yeah. We know. But for us, we want everything to work. So 35 days is way too long. They also have some ongoing scandals with mismanagement. And there are people who are waiting for care so long that they end themselves. And so this is all very bad. And we need to fix that as well.
Yep, exactly. Let's shift a little bit to Obamacare. So Obamacare was supposed to make health insurance more affordable, right? With better quality of care and fewer uninsured people. So let's talk about how that went. I have so much animosity toward Obamacare. I'll just have to lay out my bias right now. So Obamacare had no mechanism to lower costs except by temporarily subsidizing premiums with money borrowed from your children and your grandchildren. So there's that.
Yeah, let me just say that that's the sort of financial innovation that I would expect from a community organizer. Yeah, I said it. I don't like him.
Yeah. And okay, so with Obamacare, you're covering more people. So that costs more. You're mandating that more frivolous services be covered. So that costs more. Then you're adding more regulations of medical insurers and providers. So that costs more.
Compliance costs money.
Exactly. The promise, though, was that families would somehow miraculously save $2,500 a year in health insurance and healthcare costs. What actually happened, to no surprise, is that premiums doubled from 2013 to 2017, and it's gotten worse since then. So the prices just kept going up and up and up. This has not saved money in any world except for Fantasyland. There was also the promise that, that healthcare costs themselves, not that just the insurance companies or insurance premiums, but also healthcare costs themselves would drop.
Nice.
And what actually happened was that hundreds of billions of dollars in spending was added.
You're covering more people and you're covering more mandatory services. Of course, it's going to result in more spending.
Exactly. Right. Exactly. And then, of course, everybody in the U.S. at least remembers the promise over and over. If you like your doctor, you can keep your doctor. If you like your health plan, you can keep your health plan. What actually happened was that enrollees could access only about 40% of local physicians on average. And so a lot of people lost their doctor. A lot of people lost the hospital that they preferred going to or that was close to them. There were longer wait times. There was restricted access to specialists.
Yeah, I remember the fact checkers would keep saying, oh, this is real. This is true. People are saying that you won't keep your doctor, but that's so false. And then after the election, they went back and said, oh, it was the biggest lie ever.
Yeah, exactly. So if you hear, for our international listeners, if you hear someone say, yeah, and you can keep your doctor too, that's what they're referring to. It is a big joke in America now that
a big Broken promise.
Broken promise, exactly. And then, I mentioned earlier that the means of lowering costs were just through subsidies. So in other words, taking money from taxpayers and giving it to people who had Obamacare. And those temporary subsidies are actually set to expire soon, which are going to lead to very high insurance premiums, or we're going to have to dish out a whole lot more money, we as in taxpayers, in order to continue to pay for subsidies.
We're basically headed off a cliff here. People listening, this is serious stuff. So I just want to have a rant. Okay. So I'm a brown skinned guy. I came to America legally and I had to do 2 degrees in STEM and work in the private sector. And then they sponsored me. Okay. Mm-hmm. That means I had to be competent at what I did. And if I got laid off from any job, I would have been deported and have to come back again on another work permit. So I really don't like it when someone like Obama, who has no useful degrees and no significant private sector work experience in healthcare, is put in charge of healthcare policy just because his rich relatives sent him to fancy, expensive, elite schools. What I would rather see from voters is that when there's an election, they look at the people who are running and see if they have demonstrated achievement. So someone like former Louisiana Governor Bobby Jindal, he was put in charge of healthcare at the state level, and he had spectacular results of cutting costs, improving care, and all the things that we're complaining about. And I just don't want American voters to attribute competence to people like Obama who have coasted through life on good looks and happy talk. Instead, we need to look at past results just like you would if you were interviewing someone for a job in a company you owned. You would say, what have you learned? What can you do for me? What have you done? And we didn't do that with Obama, and it has cost us dearly.
So what I hear you saying is that you're a white supremacist who has internalized your racism.
I am brown. I literally have the camera on. Brown.
Okay, so the current system is awful, but there are alternatives, right? I actually, when I point out on social media or in conversations, how some of the problems that we've been pointing out with our healthcare system, a lot of times people will respond by saying, but we have to have socialized medicine because what we have right now is just so awful. Anything would be better than this.
Yeah.
They
just don't know. They're thinking this is the only way to go.
Right.
So it's an axis with 100% government control on one hand. What's on the other side?
Exactly. Yeah. Well, they're thinking that probably 80, 90% government control that we have now is the only other option.
Right.
But that is absolutely ridiculous. So
that's right.
So there's an alternative that would be consumer-driven healthcare as opposed to government-run.
Consumer-driven, consumer-focused healthcare. This is something I read a lot about. I don't know why I love healthcare policy so much, but I've read a lot of books by like Regina Hertzlinger and Sally Pipes and Michael Cannon and Michael Tanner and Avik Roy. These are guys that who really talk about this a lot. So let me tell you a little bit about this. So the current system we have is not consumer-driven. It is way too much government control, way too much employer involvement in choosing what healthcare plans you can get, and way too much meddling by insurance companies between the doctor and the patient. Mm-hmm. So what we need to do is we need to change patients into consumers so that healthcare is like online shopping. That would put the patients in control. And the way to do that is what you mentioned earlier, which is health savings accounts. Mm-hmm. You take the money, you put it into the health savings account. Either the government seeds your health savings account with money. That was Ben Carson's idea. He was like a health savings account for everybody who's born in America and put $5,000 in it or something. Yep. I don't know what the number.
Something like that. Yeah.
Yeah. And this would grow. This money would grow as you were not using it, And you can also contribute to the health savings accounts, and maybe we give you a matching grant for your contributions, but we certainly make it done out of pre-tax dollars. So this will reduce your taxable income to put money away for your own healthcare. And another couple of things that we need to do is, when I go to Amazon and I'm comparing, I'm comparing a Fiber One cereal that I use in my smoothie on Walmart.com with what it costs on Amazon.com, I can see the price. But for healthcare, you can't see the price. You can't compare. Right. You can't save money. And another thing is I can see reviews on products on Amazon and Walmart.com. You can't see any reviews of services provided by the different doctors in your area. I mean, that's something they're working on. But that would certainly help me to save some money and get a happy experience from doing,
Absolutely. Yeah. I have a story about that, actually, that's very recent. A few weeks ago or so, I went to the doctor. I had kind of a bit of pain on my arm, a spot that looked like it might be getting infected. And the doctor recommended a procedure. So I asked how much the procedure would cost. And he said, oh, I don't know anything about that. You'll have to ask the people up front. When they check you out, just ask them. So I went, I checked out. They looked at, what the doctor wanted to do. And I said, can you give me an idea of how much that would cost? So I can decide whether or not to have that done. Because this is not life or death, right? It's, and I'm going to have to pay for it. And so I want to know how much it's going to cost, or should I save up money, or should I just not have it? What's the best decision to make? And the lady who was checking me out said, oh, we don't have that information. You're going to have to call your health insurance. It completely depends on them, what they pay and all of that. So I went home, I called my health insurance company, and they said, oh, of course, after waiting, waiting on hold for half an hour, they said, well, we can't give you that information without the code from the doctor. We have to know exactly, what exactly he's going to do and what the code is for exactly what he's going to do. So I hung up. I called the doctor again, the doctor's office. And I said, I need the code for the procedure that the doctor wants to do in order to get the cost from my healthcare insurance. And she said, well, we can't give you the code until he does it, because he has to actually get into the skin and whatever and see how far he needs to go and what exactly needs to be done before he can give you the code. So I said, so you're telling me I have to have this procedure done in order to find out whether or not I can afford to have this procedure done?
Yeah, we have to pass the bill before you can find out what's in the bill.
Exactly. That's exactly what I thought of. Yes. And in fact, I said that as I was walking out the door. But yes, yes. So
this is a disaster. This is worse than going to I hate to say it, USPS or, the
Right.
driver's license place. Our driver's license place is really good in my red state.
Nice.
But yeah.
Nice. Yeah. So anyway, yes, we need transparency on prices. I think that we should have higher contribution limits to HSAs, health savings accounts. We need more health plan options.
You mean make more health plans HSA eligible so that you can pay for it?
Right. Exactly. Yes. So yeah, exactly. So right now, I think Obamacare may have some HSA eligible plans, but then the cost is raised so much that for me, at least, it's just not even worth it at all. I don't spend that much on my health care. I just spend a ton of money on health insurance for virtually no care. And so I don't want to pay more for insurance on virtually no care. So I'm not going to double my premium in order to have an HSA eligible plan. We need more healthcare plans that have HSA eligibility.
I already talked about the seeding the accounts with subsidies so that, you start with a bunch of money already.
Right.
And then the partial match contributions, that would help, just encouraging people, hey, think of the future and put aside some money today for your healthcare. Yeah. In addition to that, I think it would be great if they were made more transferable. Like if you die, your HSA could be passed on.
Definitely. Yeah. I'm not going to put a whole bunch of money into an HSA if it just goes back to the government or, when I pass away. Obviously, I'm going to invest a lot more into it if I can pass it on to my children or to, a named beneficiary. That's only right and good and just, because it makes no sense that I would put a bunch of money away and the government would just take it.
Yeah, definitely. I think some other stuff that we can do would be deregulate barriers to competition for insurers and providers. Yeah. So, for example, allowing out-of-state people to give you health insurance. If you live in Connecticut and they want to cover gender transitions and, acupuncture and, all kinds of crazy stuff, breast enlargements, and you're a man, you shouldn't be paying for that coverage. I mean, unless you're really weird. But so you should be able to get like a plan from Alaska that's just like, yeah, if you get hit by a car, we're going to cover that, and anything like that. That'll be much cheaper than the crazy, the crazy weirdo plan. So removing laws that block new hospitals and new service providers, like anytime you get competition, businesses compete, they're going to cut costs, they're going to be efficient. And you're going to pay less and you're going to get better quality because they're responsive to consumers. They have reviews posted. More people to choose from means better service. Always. Exactly. Monopolies are trash for a consumer. Giving wellness awards. We get this where I work. You get wellness rewards for patients who do preventative care and make healthy choices. I just have to tell them, my numbers and answer all their questions, tell them my blood work and everything like that. Nothing too bad, but like my heart rate and stuff. And I get I get a gift card, $200 gift card in the mail. I have it was $100. Yeah, that was it. I just think that this is the way we need to go. Health savings accounts, transparent prices, transparent reviews, and it will be basically like buying from Amazon. People would love it, and we would get out of the mess that we are in.
All right, so let's talk about how to respond to some of the arguments we hear for government-run healthcare.
You give them to me. I'll respond.
Okay, so one of the arguments I hear often is that infant mortality rates are too high in the U.S. They're so high, and so we have to give over control to the government.
It's always give control to the government is the solution, right? Never health savings accounts. Okay, so this argument's no good because the U.S. counts these infant mortalities differently than Canada and European countries.
Oh, interesting.
So we deliver premature and low birth weight babies as live births, and we try to save them. So if they die, it counts against us. But Canada and Europe classify them as stillbirths or miscarriages. And if you adjust for that difference in how they're classified, the rates are the same. And we even have a better number for full-term babies. So give me the next one.
Wow. Okay, good answer. Yes. Okay, how about this one? I hear this all the time. But healthcare is a human right.
Yeah, rights are negative. It's like I have free speech. You can't override my speech. It's not an entitlement, okay? If you have to take something from someone else to have a right, it's not a real human right. Imagine you really did have a right to healthcare. That would mean that doctors and nurses, it couldn't charge you. They would just have to give you it for free, like a slave. And if doctors and nurses, if people are looking at that and deciding whether to be a software engineer or a doctor or a petroleum engineer or a nurse, they're not going to become doctors and nurses, and you're going to get a shortage, and that's going to drive the prices up even more, because when there's a lot of people wanting something and there's a shortage of providers, prices go up. That's just supply and demand.
Yes, somebody took intro to economics.
Everybody go read Thomas Sowell.
Yes. Okay, how about this one? But life expectancy in the U.S. is lower than other countries.
Yes. Okay. So there is a problem here where we're equivocating on life expectancy when you get sick and life expectancy from your choices. So if you get sick, America healthcare is expensive, but it is the best place to get sick if you want to be cured of something serious like cancer. But the lower life expectancy we have is due to lifestyle choices. So America in some ways is so rich that people can afford drugs and they can afford to get fat. And so, sorry to offend people, but obesity, opioid overdoses, car accidents, and imagine you're living in a country where there's no cars. There's no car accidents. Okay, so okay, that's not going to be a problem.
Well, then I think we need to abolish cars. Get rid of cars.
Yes.
One death is too many. Get rid of them.
Please get this nanny state away. That sounds bad. Nobody believe her. And then, of course, so drugs, obesity, overdoses, that is what is reducing the life expectancy. If you get healthcare in this country, this is the place to get healthcare. You're going to survive.
Yep. Excellent. All right. I've got one more here for you. But too many people are uninsured. What are we going to do about that? Yeah,
this is a complaint you get from people from Canada and in the NHS in the UK. So our uninsured rate is 8%. Remember that we said that emergency rooms can't turn anyone away by law. And we also have those programs we talked about for the elderly and the poor. And we have charity hospitals and charity care. There are people who provide that. And in addition to all that, you have to understand that we give people the freedom to not pay for healthcare if they don't think that they're going to need it. I didn't need healthcare as a single man until I was like 40 or something. And I started, needing stuff So sometimes it's just not worth it to pay for it if you know you have a safe lifestyle, you live in a safe place.
Okay, let's talk about one of my favorite topics. How is Canada's single payer system performing?
Oh, it's terrible. Okay, so let me just run through the numbers. So this is from the Fraser Institute from December 2025. So their median wait time for treatment is 29 weeks. So just imagine that.
Insane. I can't even imagine that. And you said, yeah, and that's the average. I mean, some places you said it's like 60 weeks.
In maritime provinces, it's like 60 weeks.
That's just insane. The whole thing's insane. 29 weeks is insane.
19,000 Canadian dollars in taxes per family of 4. That's from the Fraser Institute, September 25. So I'm going to guess that's around 15,000 US. I don't know.
So you're telling me it costs 19,000 per year Canadian for free health insurance.
For free health insurance for a family of 4. That's the median family of 4. So let me give you a quick horror story. They have horror stories. So in 2023 to 2024, a patient in the province of Ontario named Susan Griffiths waited 9 months for lung cancer surgery. While she was waiting, the tumor grew. It became inoperable, and she just died while on a wait list. And that happens a lot in Canada.
It's so sad.
In Canada, if you're a Christian taxpayer, you can look forward to such wonderful taxpayer-funded services as abortion without limits. No, there's no opt-out. You can pay for people's transgender drugs and surgeries. No opt-out. And you can pay for people's IVFs for feminist professors who delay, having children. They can bill you for 3 rounds of IVF. In addition,
insane.
If you're a Christian worker, Catholic hospitals and doctors have been sued or pressured to allow euthanasia, which is like ending the elderly and also performing transgender procedures on site or referring them. And if you don't want to do that, you risk losing your job or losing your license. And
you mentioned euthanasia for the elderly, but it's not just the elderly anymore.
No, they're going for children now. So they have a program called Medical Assistance in Dying, which is known as MAID. And it actually accounts for 5.1% of all deaths in 2024 in Canada. So this is socialized medicine. This is single payer healthcare. They don't actually give you the healthcare. They just give you this pathway to dying.
Wow. Okay, well, what about the UK's single payer national
really similar, actually.
Service?
So they have 7.3. This is let's talk about the UK's single payer national health service. So this is 7.31 million people out of 70 million are on waiting lists, waiting for care. 7.31 million out of 70 million. That's from the NHS England from November 2025. These are recent numbers. I looked these all up. Their average cost per person is about $5,000 USD. So a family of 4, it's about $20,000 USD. That's based on 2024 and 2025 averages. So sample horror story. So this is from 2024. A 78-year-old woman waited 18 months for a hip replacement. This is a big problem in Canada, hip and knee replacements as well. She waited 18 months for her hip replacement, and then she fell down at home, broke her femur, and died from complications while still on the waiting list for the hip replacement.
Unbelievable.
Again, taxpayers are funding abortions for up to 24 weeks, and you can actually get them later for quote unquote health reasons. You're paying for transgender drugs, transgender surgeries, multiple rounds of IVF, and this is the funniest one: breast enlargements. If somebody decides that they need breast enlargements,
those are important health adjustments.
Yeah, this is just cosmetic. You apply for it because you want to do OF or something, and you say, hey, I need to do OF. And please don't ask what that is if you don't know. And they'll go, oh, yes, totally. We need to take the taxpayer money and enlarge your breasts. Okay.
I need to do OF, and also I'm deciding who to vote for the next 50 years. Let's see.
Yeah, young people get treated because they vote for bigger government and bigger healthcare. Old people, their voting is done. So it's okay. And I'll tell you, they have a program just like MAID. It's called the Liverpool Care Pathway. And this is where hospitals are paid bonuses in order to place sick patients on end-of-life protocols. And they end-of-life them by withdrawing food and fluid. And they also have conscience horrors. So Christian NHS nurses and doctors face pressure to participate in or refer people for abortions and transgender procedures. And it's really hard to opt out. It's really, really hard to get an opt out.
And they call this, encouraging people to end their lives. They call it the care pathway. You got to be kidding me.
Liverpool care pathway. Now, I have to point out that once this was discovered, it was ended. But for a while, hospitals were being paid bonuses to take patients off of treatment so that the government would be billed less. This is government-run healthcare. Let's be clear on this. There's no free money. There's no free lunch.
Right. Yep. They'd have to decide what to spend it on and who to spend it on. It takes all the agency away from the individual and puts it in the hands of the government bureaucrats.
Yeah. Think of that as a Christian. That's sort of the homework for this episode.
Yeah, exactly. And, it's something that I bring up often when we talk about healthcare is our friend Dina, who died a few years ago. She started having tremendous pain. It got worse and worse. She tried going to the doctor. She tried going to the ER multiple times. Basically, they were like, oh, here, take some Tylenol and we'll put you on the wait list to get a test at some point, sometime in the future. It's probably no big deal. And she is going home and she is screaming, crying, calling you for help and just suffering horrifically. And she couldn't get a basic MRI, a CAT scan, a basic test to figure out what was wrong with her.
It took them 8 months to agree to do a diagnosis that revealed that the underlying problem was actually cancer.
Yeah. And I recall looking up the cancer, the type of cancer that she was eventually diagnosed with once it had spread all over, though. And it is a type of cancer that is virtually always treated with full success in the United States.
If diagnosed quickly. But they took 8 months to do this. And then even the treatment itself took a long time afterwards. So this person was critical in my life. She contacted me through my blog. She wanted book referrals, which is the best way to get me to immediately be your friend, is ask me what I think you should be reading. And we became fast friends. We were friends for like 10 and a half years. She made a cross stitch of my beloved parrot, who was alive for 32 years, who was really critical. I really love that parrot, and she made a cross stitch of him. And everybody who knows me knows who I'm talking about. And I used to send her flowers to the office so that she could show off and talk to her secular left coworkers. She worked in a hospital, which makes it even more weird.
She had all the connections. She worked for the NHS, and she couldn't get treatment.
She was super high up in the NHS, and I would send her these flowers for her to show off to her secular friends. So this was someone who was a source of wisdom and comfort and loyalty and advice to me, critical in my life, just one of my most important people, maybe the most important person at that time of my life. She spent
the last year of her life screaming in agony on the floor and until she died.
She had fell down and got bruises, and it was just to me this was a disaster. Yeah,
and we're not talking about a 90-year-old woman either. She was 50. She was 50. So it's unbelievable. It makes me so angry. She would be alive today if she had been in the U.S.
I know.
All right. Well, today we have covered healthcare policy from the standpoint of the taxpayer and the patient. I think that's a good place to stop for today.
I think if you enjoyed this episode, you should really consider helping us out by sharing this podcast with your friends, writing us a 5-star review on Apple or Spotify, subscribing and commenting on YouTube, and hitting the like button wherever you listen to this podcast. We appreciate you taking the time to listen, and we'll see you again in the next one.